Welcome to Atlanta House Healthcare Services Virtual Orientation Course. This course has been thoughtfully designed to do more than introduce policies. It is the foundation of your success with our team. We believe that when our caregivers and clinicians are supported, educated, and empowered, they are better equipped to provide exceptional care to the individuals and families we serve. This orientation welcomes you into the Atlanta House Healthcare family and introduces you to our mission, values, and unwavering commitment to compassionate, safe, and high-quality home care. Our goal is to ensure you feel confident in your role, supported by leadership, and prepared to grow both professionally and personally within our organization. The topics covered in this course include agency services and scope, job duties and limitations, client rights and complaints, reporting and emergency procedures, and infection control. Additional training areas include TB hepatitis exposure reporting, documentation standards, service plans, supervision and evaluations, ongoing training requirements, and timekeeping and payroll procedures. Through this orientation, you will gain a clear understanding of your responsibilities, scope of practice, and the standards required by Atlanta House Healthcare Services and the Georgia Department of Community Health. We emphasize teamwork, accountability, and open communication. So let's go ahead and get started. One of the most important responsibilities you have as a caregiver at Atlanta House Healthcare Services is documentation. Documentation is how we show what care was actually provided, that services followed the client's service plan, that the client was safe, and that we are compliant with Georgia Department of Community Health regulations. If it's not documented, it is considered not done, even if you provided excellent care. Clinical and progress documentation is the written record of the care you provide during each visit or shift. This documentation tells the story of the client's condition, the care you provided, how the client responded, and any problems, concerns, or changes that occurred. Georgia DCH requires providers to document all services actually performed for every client. Skilled nursing notes must include assessments, interventions, and client response, signed and dated by the nurse. As a CNA, PCA, or caregiver, you must document personal care tasks you performed, companion or sitter tasks, observations of the client, and any concerns or changes in condition. You do not diagnose or make clinical judgments, but you do observe and report. Documentation must match the service plan. Only document authorized services. Good documentation answers 3 questions. What did you observe? What care did you provide? How did the client respond? Any change in condition must be documented and reported immediately, including changes in appetite, confusion, skin issues, pain, falls, or behavioral changes. Documentation must be accurate, timely, honest, completed the same day, and include your signature and date. Examples of acceptable documentation include assisted client with bathing and dressing, client cooperative and tolerated care well, or client appeared more fatigued than usual, nurse notified. Unacceptable examples are vague phrases like client doing fine, everything normal, or no issues. Never copy and paste old notes, document care you didn't provide, or allow someone else to complete your documentation. Atlanta House Healthcare Services uses electronic systems like Care Bravo or Connect Team. You must clock in and out at the client's location, complete documentation after each shift, and ensure times and tasks match what was provided. Remember, client documentation is confidential. Never share information with unauthorized individuals, take pictures of documentation, or discuss client details outside of work. Let's summarize. Document every shift, follow the service plan, record what you observed, what you did, and how the client responded. Report and document changes in condition. Complete documentation the same day, and sign and date your notes. When documentation is done correctly, it protects the client, you as a caregiver, and Atlanta House Healthcare Services. At Atlanta House Healthcare Services, it is very important that every caregiver understands what services we are licensed to provide, and just as importantly, what services we are not allowed to provide. Georgia Department of Community Health requires that all employees are trained on the scope of services before working with clients. This protects our clients, you as a caregiver, and our agency license. Providing care outside your scope can result in serious consequences, including termination and loss of licensure. Scope of services means The types of care Atlanta House Healthcare Services is licensed to provide, the specific tasks you are allowed to perform based on your job role, and the services authorized in each client's service plan. You may only provide services that are allowed by Georgia DCH, assigned to your job role, and authorized in the client's service plan. Atlanta House Healthcare Services provides three main types of services. First, skilled nursing services provided only by licensed nurses, RNs or LPNs. Second, personal care services provided by CNAs, PCAs, and HHAs to help clients with activities of daily living. And third, companion or sitter services when assigned, which include safety supervision and companionship. Skilled nursing services are provided only by licensed nurses, RNs or LPNs. These services may include skilled assessments, wound care, catheter care, medication administration when ordered, tube feeding care, and monitoring complex medical conditions. If you are not a licensed nurse, you may never perform skilled nursing tasks, even if a client or family member asks. Caregivers do not complete skilled nursing notes unless they are licensed. Most caregivers provide personal care services, which help clients with activities of daily living. These include bathing and hygiene, dressing and grooming, toileting and incontinence care, transfers and mobility assistance, feeding assistance that's non-skilled, and repositioning and skin observation. These services must always match the service plan. Every client has a written service plan that tells you what services are authorized, how often they are provided, and any special instructions or limitations. There are services we are not licensed to provide, and caregivers must never perform them. Services not allowed include medical diagnosis, changing treatment plans, giving medications unless authorized and trained, wound care unless delegated appropriately, injections unless you're an RN or LPN, handling client money without authorization, and tasks outside your job description. As a caregiver, you are expected to observe and report, not diagnose or treat. If you are ever unsure, stop and call your supervisor. Let's recap. Atlanta House Healthcare Services provides skilled nursing, personal care, and companion services. Your role determines what tasks you can perform. The service plan guides all care. Never work outside your scope. When unsure, call your supervisor. If a client or family asks you to do something outside your scope, say no politely, explain you must follow agency rules, and contact your supervisor immediately. You will never be punished for asking questions or protecting a client. At Atlanta House Healthcare Services, we believe every client deserves to be treated with dignity, respect, and compassion at all times. Georgia Department of Community Health requires that all caregivers understand client rights, client responsibilities, and complaint procedures before providing care. These rights exist to protect our clients, and it is your responsibility as a caregiver to honor and support them. Client rights are protections guaranteed by Georgia law and Atlanta House Healthcare Services. Every client has these rights, regardless of age, condition, diagnosis, or payer source. Clients have the right to be treated with courtesy, respect, and dignity, receive care free from abuse, neglect, or exploitation, have their privacy and confidentiality protected, be involved in decisions about their care, know the services being provided, refuse care or services even if you disagree, be free from discrimination, receive care in a safe environment, voice concerns or complaints without fear of retaliation. These rights apply at all times, during every visit and every interaction. Client information is confidential. You must protect all personal and medical information and discuss client details only with authorized staff. You may not share information with friends or family, post about clients on social media, or take photos or videos of clients or their records. Violating confidentiality is a serious offense and may result in termination. Just as clients have rights, they also have responsibilities in the care relationship. Client responsibilities may include treating caregivers with respect, providing accurate information about their condition, following the agreed-upon service plan, maintaining a safe home environment, communicating concerns or changes in condition, and not asking caregivers to perform tasks outside their role. Even if a client does not meet all responsibilities, their rights must still be respected. A complaint is any concern expressed by a client or family member about care provided, a caregiver's behavior, scheduling, or services, or safety, privacy, and respect. If a client or family member raises a complaint, you must listen calmly and respectfully. Do not argue, blame, or become defensive. Do not promise outcomes you cannot control. Report the complaint to your supervisor immediately and follow agency instructions for documentation if required. You are not expected to solve complaints on your own. Reporting is your responsibility. Never ignore complaints, discourage a client from complaining, threaten, pressure, or retaliate, or treat the client differently after a complaint. Clients have the right to file a complaint directly with the Georgia Department of Community Health, with or without notifying Atlanta House Healthcare Services, and without fear of retaliation. Let's recap. Clients have the right to dignity, privacy, and safe care. Clients may refuse care and voice concerns. Complaints must be reported immediately. Retaliation is never allowed. Confidentiality must always be protected. Respecting client rights is not optional. It is required by Georgia law and Atlanta House Healthcare Services. One of your most important responsibilities as a caregiver is reporting. Georgia Department of Community Health requires caregivers to immediately report changes in condition, incidents, and emergencies. Reporting protects the client's health and safety, you as a caregiver, and Atlanta House Healthcare Services. Remember this rule: if you see it, hear it, or suspect it, you report it. A change in condition is anything that is different from the client's normal or baseline condition. You must report changes such as increased confusion or agitation, changes in behavior or mood, pain or discomfort, shortness of breath, weakness, dizziness or fatigue, skin redness, wounds or swelling, changes in appetite or sleep, fever, chills or signs of infection, and refusal of care or medications. You are not expected to diagnose. Your role is to observe and report. When you notice a change in condition, you must ensure the client is safe. Notify your supervisor or nurse immediately. Follow any instructions given, and document what you observed and what was reported. An incident is any unusual or unexpected event that affects a client's safety or well-being. Common incidents include falls with or without injury, injuries or accidents, medication errors or missed medications, client wandering or elopement, property damage related to care, aggressive or unsafe behavior, and near-miss events. Even if the client says they are fine, incidents must still be reported. An emergency is a life-threatening situation that requires immediate medical attention. Emergency examples include difficulty breathing, chest pain, uncontrolled bleeding, loss of consciousness, stroke symptoms, seizures, and serious falls or injuries. In an emergency, call 911 immediately, stay with the client if safe to do so, follow any emergency instructions you are trained to perform, notify your supervisor after calling 911, and document what occurred. Never delay emergency care to call the office first. Georgia DCH requires that all changes in condition, incidents, and emergencies are properly documented. Documentation must be completed the same day, be accurate and factual, reflect what you observed and reported, be signed and dated, and match any incident reports submitted. If it's not documented, it's considered not done. Do not ignore changes in condition, delay reporting incidents, attempt to handle emergencies alone, falsify or minimize events, or blame the client or others in documentation. You will never be punished for reporting concerns or emergencies in good faith. Georgia DCH requires agencies to support reporting and protect caregivers who report safety concerns. Let's recap. Report all changes in condition. Report all incidents even if no injury occurs. Call 911 first in emergencies. Notify your supervisor immediately. Document accurately and promptly. Reporting saves lives and keeps everyone safe. Infection control, home safety, and sanitation are critical parts of the care we provide at Atlanta House Healthcare Services. Georgia Department of Community Health requires all caregivers to follow infection prevention and safety standards to protect our clients, ourselves, and our community. Many of our clients have weakened immune systems, chronic illnesses, or mobility challenges. What you do, or fail to do, can directly affect their health and safety. Infection control means taking steps to prevent the spread of germs, bacteria, and viruses in the client's home. Hand washing is the single most important way to prevent infection. You must wash your hands. before and after each client interaction, before and after providing personal care, after using the restroom, after coughing, sneezing, or blowing your nose, after contact with bodily fluids, and after removing gloves. Use soap and water, scrub for at least 20 seconds, and dry hands completely. If soap and water are not available, use hand sanitizer, but wash with soap and water as soon as possible. Personal protective equipment, or PPE, helps protect both you and the client. PPE may include gloves, masks, and gowns if instructed. Wear gloves when contact with bodily fluids is possible. Never reuse disposable gloves. Remove gloves properly and wash hands immediately. Standard precautions mean treating all blood and bodily fluids as potentially infectious. You must avoid direct contact with blood or bodily fluids. Use gloves as needed. Clean and disinfect surfaces properly, and report exposures immediately. If you are exposed to blood, bodily fluids, or a communicable disease, you must report it immediately to your supervisor. Home safety is about preventing accidents, injuries, and falls in the client's environment. You must be alert for cluttered walkways, loose rugs or cords, poor lighting, wet or slippery floors, unsafe furniture or equipment, and pets that may cause tripping. Falls are one of the most common causes of injury in home care. You should encourage use of assistive devices like walkers and canes, keep walkways clear, ensure proper footwear, assist with transfers as authorized, and report safety hazards to your supervisor. Every caregiver should know how to respond in an emergency. Know where emergency contact numbers are located. Call 911 immediately for life-threatening emergencies. Stay with the client if it is safe, and notify your supervisor after emergency services are contacted. Sanitation means keeping the client's environment clean to prevent illness and promote safety. You may be responsible for cleaning and disinfecting equipment used during care, cleaning surfaces related to personal care tasks, proper disposal of gloves and waste, and following service plan instructions for light housekeeping if authorized. Never use harsh chemicals unless authorized. Used linens and waste must be handled carefully. You must wear gloves when handling soiled linens, avoid shaking linens, place waste in appropriate containers, and wash hands after disposal. What caregivers must never do. Do not provide care if you are sick without notifying your supervisor. Ignore infection control procedures. Reuse disposable gloves or PPE. Perform tasks outside the service plan, or leave safety hazards unreported. Georgia DCH requires that infection control and safety concerns be reported and documented. You must document safety hazards observed, client refusals related to safety or hygiene, exposure incidents, and education provided to clients and families. Let's recap. Hand hygiene is critical. Use PPE correctly. Follow standard precautions. Report exposures immediately. Watch for safety hazards. Prevent falls. Maintain clean and sanitary environments. Infection control and safety are everyone's responsibility. Tuberculosis and hepatitis are serious infectious diseases that can be spread through contact with bodily fluids or respiratory droplets. Georgia Department of Community Health requires all caregivers to understand how to prevent exposure, recognize possible exposure, and report it immediately. Reporting exposure protects our clients, you as a caregiver, your coworkers, and the community. Failure to report exposure can put lives at risk and may result in disciplinary action. Tuberculosis, or TB, is a contagious disease that usually affects the lungs and spreads through the air when an infected person coughs, sneezes, or talks. Common TB symptoms may include persistent cough lasting more than 3 weeks, coughing up blood, chest pain, fever or chills, night sweats, unexplained weight loss, and fatigue. Many clients may have a history of TB or be at higher risk due to weakened immune systems. Hepatitis is an inflammation of the liver caused by viruses such as hepatitis B or hepatitis C. Hepatitis is most commonly spread through contact with infected blood or bodily fluids. Hepatitis exposure risks include contact with blood or bodily fluids, needle sticks or sharps injuries, open cuts or broken skin exposed to fluids, and improper glove use. Exposure may occur during routine caregiving if infection control procedures are not followed. Examples include blood or bodily fluids splashed into eyes, nose, mouth, contact with blood on broken skin, needle stick or sharps injury, and prolonged close contact with someone suspected of active TB without protection. The best way to prevent exposure is to follow infection control practices at all times. You must wash hands before and after care, use gloves when contact with bodily fluids is possible, use masks or PPE as instructed, follow standard precautions with every client, and never reuse disposable PPE. Georgia DCH requires caregivers to complete TB screening at the time of hire and annually thereafter. You are responsible for keeping your TB screening current and submitting documentation to the agency. If your TB screening is not current, you may be removed from client assignments. You must report immediately if you believe you were exposed to TB or hepatitis, have contact with blood or bodily fluids without proper protection, experience a needle stick or sharps injury, are informed that a client has active TB or hepatitis, or develop symptoms consistent with TB or hepatitis. If exposure occurs, stop care if necessary and ensure safety. Wash exposed area immediately. Notify your supervisor as soon as possible. Follow instructions for medical evaluation. Complete required incident or exposure reports, and do not return to client care until cleared, if instructed. Let's recap. TB and hepatitis are serious infectious diseases. Follow infection control at all times. Complete TB screening at hire and annually. Report any exposure immediately. Do not ignore symptoms. Confidentiality and non-retaliation are guaranteed. Reporting exposure protects everyone. Every client we serve at Atlanta House Healthcare Services has a written service plan. Georgia Department of Community Health requires that all services provided to a client follow this service plan exactly. The service plan protects the client's safety, you as a caregiver, our agency license. One of the most important rules you must remember is this: you may only provide services that are authorized in the service plan. A service plan is a written document that outlines the services the client is approved to receive, how often those services are provided, any special instructions or limitations, who is authorized to provide the care. The service plan is created by Atlanta House Healthcare Services and updated as the client's needs change. Before providing care, you are responsible for reviewing the client's service plan, understanding your assigned tasks, asking questions if anything is unclear. You must follow the service plan exactly, no more and no less. Authorized services are those clearly listed in the service plan. Examples may include bathing and hygiene assistance, dressing and grooming, toileting and incontinence care, transfers and mobility assistance, feeding assistance, non-skilled, repositioning, safety supervision. Unauthorized services are any tasks not listed in the service plan or outside your job role. Examples include skilled nursing tasks if you are not licensed, giving medications unless specifically authorized, wound care or catheter care unless RN, LPN, housekeeping beyond what is authorized, running personal errands not approved, handling client money without authorization. Even if the client or family asks, you must not provide unauthorized services. Georgia DCH requires documentation to match the service plan. You must document only authorized services, document what was actually provided, report refusals of authorized care, sign and date documentation. If documentation does not match the service plan, it may be considered non-compliant. Providing unauthorized services can result in client harm, agency penalties, loss of licensure, disciplinary action, or termination. Let's recap. Every client has a service plan. You must review and follow it exactly. Provide only authorized services. Never add or remove tasks on your own. Report changes in condition. When in doubt, call your supervisor. Service plans are not optional. They are required by Georgia law. At Atlanta House Healthcare Services, supervision and performance evaluations are designed to support you, not to intimidate you. Georgia Department of Community Health requires agencies to supervise staff and evaluate performance to ensure safe, competent care. Supervision helps keep clients safe, support caregiver growth, ensure quality and compliance. We view supervision as a partnership focused on your success. Every caregiver at Atlanta House Healthcare Services has a clear supervision structure. Depending on your role, CNA, PCA, companion staff are supervised by a designated supervisor or RN. RN, LPN staff are supervised by nursing leadership or agency management. Your supervisor is your primary point of contact for questions, concerns, or guidance. Supervision may occur in several ways: on-site home visits, direct observation during care, review of documentation, phone or virtual check-ins, and performance feedback discussions. Georgia DCH requires supervisory visits to ensure staff are performing tasks safely and competently. These visits are completed within required timeframes. Supervisors observe care or review caregiver performance, and feedback is documented and placed in your personnel file. These visits are routine and required by regulation. A performance evaluation is a formal review of how you are performing your job duties. Georgia DCH requires a written performance evaluation completed at least annually, based on observation or demonstration of skills. Your evaluation may include adherence to service plans, quality of care provided, infection control practices, documentation accuracy and timeliness, professional conduct, communication with clients and staff, and attendance and reliability. Evaluations are based on facts and observations, not opinions. Georgia DCH requires that caregivers demonstrate competency for assigned tasks. Competency may be evaluated through direct observation, skill demonstration, review of documentation, and client feedback. Feedback is provided to help you grow. You may receive verbal coaching, written feedback, and additional training or education. Feedback is not punishment, it's an opportunity to improve. If performance concerns arise, corrective action may be taken, including retraining, increased supervision, written warnings, or removal from assignments if safety is a concern. Corrective action is handled fairly and consistently. You have responsibilities related to supervision. Cooperate with supervisory visits, participate in evaluations, accept feedback professionally, ask questions when unsure, and complete required training. All supervision and evaluation records are confidential, maintained in your personnel file, and information is shared only with authorized staff. Atlanta House Healthcare Services is committed to fair, respectful supervision. Let's recap. Supervision is required by Georgia DCH. Supervisory visits are routine. Performance evaluations occur at least annually. Feedback supports growth. Competency must be demonstrated. Participation is required. Supervision helps us deliver safe, high-quality care. At Atlanta House Healthcare Services, training is not optional. It is required by Georgia law and is essential to providing safe, high-quality care. Georgia Department of Community Health requires all caregivers to complete mandatory training before working with clients and to participate in ongoing annual education. Training protects our clients, supports your professional growth, and ensures we remain compliant as an agency. Before you provide any client care, you must complete new employee orientation. Orientation includes required topics such as scope of services, assigned job duties and responsibilities, client rights and complaint procedures, reporting changes in condition, incidents, and emergencies, infection control and safety, TB and hepatitis exposure reporting, documentation standards, service plans and authorized services, supervision and performance evaluation process. You may not work with clients until orientation is completed and documented. Mandatory training includes all education required by Atlanta House Healthcare Services and the Georgia Department of Community Health. This may include job-specific skills training, competency validation, policy and procedure training, safety and infection control education, documentation training. Training must match your assigned role and responsibilities. After your first year of employment, Georgia DCH requires caregivers to complete at least 8 hours of annual in-service training. Annual in-service training must be completed every year, must be relevant to your job duties, may include online courses, in-person training, or competency reviews, is documented and placed in your personnel file. Failure to complete annual training may result in removal from assignments. You are responsible for your training. Caregivers must complete required courses by assigned deadlines, participate in skills demonstrations or evaluations, keep certifications current, CPR, CNA, etc. if applicable, provide documentation of completed training when requested. Training reminders may be sent, but meeting deadlines is your responsibility. Georgia DCH requires documentation of all training. Training records must show dates of completion, identify training topics, include instructor or platform used, be signed or electronically verified. If training is not documented, it is considered not completed. Additional training may be required if your role changes, new policies are introduced, performance concerns are identified, new client needs arise. This training is designed to support you, not punish you. Failure to complete required training may result in removal from client assignments, delayed scheduling, corrective action, termination if non-compliance continues. Training compliance is required by Georgia DCH. Let's recap. Orientation is required before client contact. Mandatory training must be completed as assigned. Annual in-service training, minimum 8 hours, is required after your first year. Training must be documented. You are responsible for meeting deadlines. Ongoing training helps you grow and keeps our clients safe. Payroll and timekeeping are directly connected to your pay, our compliance, and our ability to continue serving clients. Georgia regulations require agencies to maintain accurate records of services provided, including the dates and times care is delivered. At Atlanta House Healthcare Services, we use CareBravo for clocking in and out, and Gusto for payroll and pay stubs. Following these procedures exactly ensures you are paid accurately and on time. Our work week begins on Monday and ends on Sunday. All hours worked between Monday-Sunday belong to the same payroll week. This applies to all caregivers, regardless of shift or assignment. Payroll is processed after the work week ends. Payroll is reviewed and submitted after Sunday. Pay is issued according to the agency payroll schedule. Payments are made through Gusto. If time is not recorded correctly by the deadline, payment may be delayed. You must clock in and clock out in CareBravo for every shift. You must clock in at the client's location, clock out at the client's location, use your own login credentials, and record time for each shift worked. You may not clock in early or clock out late without authorization. Clock in or out from home or another location, or ask another caregiver to clock in or out for you. This is required for payroll accuracy and compliance. If you forget to clock in or out, notify your supervisor immediately, follow instructions to correct the time, and complete any required correction forms. You must only record actual hours worked. This means no guessing time, no rounding up or down, and no documenting time not worked. Falsifying time records is a serious violation and may result in termination. Gusto is the secure payroll system Atlanta House Healthcare Services uses to pay employees and provide pay stubs. Through Gusto, you can receive your pay through direct deposit or check, view pay stubs, update personal information as instructed, and access tax documents like W-2s. You are responsible for making sure your information in Gusto is accurate, including your correct legal name, address, and bank account information if using direct deposit. Your pay stubs are available through Gusto and show hours worked, rate of pay, gross pay, taxes and deductions, and net pay. You should review every pay stub and report discrepancies immediately. Please remember, clock in and out for every shift, use CareBravo at the client's location, work week is Monday-Sunday, payroll is processed through Gusto, keep your Gusto information current, and if it's not clocked, it may not be paid. If you have a payroll question or concern, review your CareBravo time entries, review your Gusto pay stub, and contact the office with specific details. Let's recap. CareBravo is used for timekeeping. Gusto is used for payroll and pay stubs. Clock in and out every shift at the client's location. Work week runs Monday through Sunday. Review your pay stubs regularly. Report issues promptly. And accurate timekeeping ensures accurate pay. We are here to help, but accurate clock-ins are required for us to assist you. Congratulations on completing your orientation, and welcome. We're excited to have you join our team and grateful for the commitment you've shown in taking this important first step. You are now part of a community that values compassion, professionalism, and excellence, and we look forward to seeing the positive impact you'll make. If you have any questions or need support along the way, know that we're here for you. Welcome aboard. We're glad you're here.